So a little bit about me, just so you know where I'm coming from. I'm trained as a pediatric psychologist. I did my undergraduate in a small college here in the United States that was an undergraduate in neuroscience psychology, and then specialized in clinical psychology and did some fellowship training at the Children's Hospital of Philadelphia. I'm now at University of Kentucky, UCare Healthcare, where I am the acting division chief, and we work with kids with medical conditions broadly, including quite a bit with our oncology team here. I also am a co-author with a book called Afraid of the Doctor. I'm going to talk a little bit about that book today. And then I have a company called the Celly Coping Company as well, where we try to translate some of the ideas from science and evidence into actionable skills that parents and kids can implement together. And then you can see a picture of my beautiful boys there who I've already referenced in this talk. Quick disclosures, I am an author of the Afraid of the Doctor book and a co-inventor and CEO of the Celly Coping Company. And so just to get a sense, I always like to disclose that out there, that there could be financial benefits for either of those tools. We're going to spend a few minutes this morning talking about what medical traumatic stress is, and this really follows on what Natalie and Andrea just shared in the previous presentation. We're going to talk a little bit about how to recognize symptoms and signs, and then try to spend hopefully some time talking about some strategies that you can implement as parents. And then just something to keep in mind too, if you need help for yourself or your child or siblings or anyone in your family, don't be afraid to ask for it. The journey of neuroblastoma is very significant, and it is completely reasonable to ask for help when you need it. So thinking about what medical traumatic stress is, there's a big fancy definition under this definition, which basically says when we think about medical traumatic stress, we think about all the body symptoms that we have in addition to the emotional health reactions that we have. And so thinking kind of like, what are our emotional reactions to scary medical stuff? And one thing to keep in mind as a parent is that the scary medical stuff differs for every kid. So sometimes the things that you would think your child might be afraid of, or that the medical team might think might be scary, kids just roll with it. And they're like, yeah, no big deal. And then other times things that you're like, this doesn't seem like a big deal. Why is my child kind of having a long, big reaction to this? It can be really scary for kids. So just kind of keeping in mind when we think about what is the scary medical stuff, to really think about it from our kiddos' perspectives and from our own perspectives as well. Some common terms that are also used for medical traumatic stress are kind of listed here. Medical anxiety, and I know my colleagues talked a little bit about that. Medical trauma, post-traumatic stress disorder. So if you look in the literature or Googling and trying to sort this out, you might find a number of different terms for this. So my colleagues really shared about a number of kind of signs and symptoms, kind of thinking about when your child is kind of acting out of normal, like things to watch for. Some of the other details on the symptoms that we look at is we look for changes in our kids, and again, trying to keep siblings in mind as well, and then ourselves and other caregivers. But we look for things like withdrawing, starting to be more worried than we would anticipate, that sadness, anger, irritability, any of the kind of those big overall shifts in mood. And then things like in the re-experiencing bucket, sometimes our kids will act out things that they're afraid of in their play, in their art. Some of our kids might have nightmares or bad dreams. For kids, sometimes the bad dreams are not necessarily specific about the trauma, or they can't remember the nature of them, but it can still indicate that they might be having some significant medical anxiety or traumatic stress. We have some of our kiddos that talk about things nonstop. Might have racing thoughts about it. I think, again, thinking about from a parenting perspective as well, what your own experience is with this. Kind of on the flip side, we've got other kids that don't want to think about it at all, don't want to talk about it. When I talk to medical teams about what this looked like, I often will say, sometimes we have kids that are like the fake sleepers. If you're in the hospital and the medical team comes in and your child pretends to be asleep, or even for some of our parents, so keeping an eye for yourself, if some of our parents will kind of miss rounds on purpose because it kind of just triggers and is really anxiety provoking. You're afraid you're going to get bad news. And so just trying to avoid facing that as well. Sometimes, if you have multiple caregivers, some of these symptoms, if both people are having kind of traumatic stress reaction symptoms, can be really difficult because you might have one person who wants to talk about it all the time, another person who wants to completely avoid it. And so being aware of your own symptoms in yourself, and if you have a partner or grandparents or other folks involved in care, you can, kind of keep in mind that everyone responds differently, and it can also be a trauma reaction that comes out in a different way. This also can be difficult if you're not sure how much information to share with your child and they don't want to hear about it, or, so just something to keep in mind. And then thinking about kind of those physiological body reactions, like that fight or flight, like feeling like, you're frozen, or we have kids that actually do try to physically run away, kick or fighting treatment. Those kinds of things are good to keep an eye on and ask for help if you're seeing some of these from your medical team. One of the things that can be tricky for families and medical teams alike to sort out is there's some other things that can look like traumatic stress symptoms, or that can be hard to sort out. Sometimes if kids are having ongoing pain, some of those symptoms are similar. Then oppositional behaviors as well. Sometimes a child, it's hard to sort out if they're really anxious and having anxiety versus if they're like just not wanting to do it. So sorting out some of those other things. Sleep problems. I know one of my co-presenters right at the beginning talked a little bit about sleep. And we know that sleep problems make everything worse as far as emotional health. So if there are sleep problems, addressing those with your medical team so that you can help sort out, is there other things beyond the sleep? Or if we address the sleep, does some of the other things resolve? So thinking about it for your family, how common is this? We know about 30% of kids with significant injury or illness have traumatic stress symptoms in kind of that early new diagnosis period. And then longer term, it really ranges. Up to 75% of kids can have persistent symptoms. In pediatric oncology, there's some data that suggests 60% of siblings have significant symptoms of medical traumatic stress. So again, keeping in mind the siblings as well. And a fair number of parents also have significant symptoms as well. Well, and so I always like to kind of take a minute to say, the reason that we do this talks is, one, to try to educate and say, oh, this is what might be going on for you or your family, or to keep an eye out for it, but to also say you do have some control of how you manage it. So a lot of times in things like neuroblastoma, we don't have control of the medical treatment necessarily. We don't have control on how our bodies respond, how our child responds, but there are things that we can do to try to help you manage the emotional reactions. So I'm going to spend the next few minutes talking about some strategies. And so one of the strategies that my co-author, Melissa, who is a mama of a kiddo with some substantial medical needs, and we wrote this together thinking about how can parents work with their child and empower their child. And so one of the models that we suggest in this book is to think through collecting information. So if you notice a behavior in your child, taking time, learning more about the medical procedure, learning more about what's necessary, what's flexible, what could the medical team do to help, observing, paying attention to, are there different things that make it better or worse, asking for help from the team if you need to. If your child's old enough, maybe choosing some strategies with your child and partnering together. And then you work to kind of help your child through this with the strategy. And then you just repeat that cycle as needed. So if it doesn't work quite right that time, kind of repeat it again and pivot a little bit. So that's a framework that we suggest thinking about when you have a challenge in your child, such as like a needle stick or port access or something, kind of looking through all these different pieces and kind of making a plan together with your child and medical team. There's some other many strategies. I'm going to go through a couple more before the end of the day, but just talking about a little bit here, other ideas of things that you can do as a parent, things like planning ahead, thinking when there are options about time of day for your medical care. Sometimes there's not options, but if there is an option, can you plan ahead to kind of schedule it in a way that makes sense for your child and your family? Really thinking about communication, being consistent in how we kind of reinforce and support our child's positive behaviors. There's a number of different things we can try over time. And if one doesn't work, you kind of pivot and figure out different things work for different parents, different kids, and different families. So talking a little bit about medical play, this can be particularly helpful for kids that are younger or whose kids have more cognitive limitations. Um, this is really thinking about kind of helping your child get used to the medical kind of gear, allowing them for free play. The other thing this can really help with, especially with kids that either have limited communication abilities or are younger, is to create a shared language between yourself and your child. For example, my colleague Melissa and her son work together, and they call needle sticks poke. And they're going to get the poke. And so they created like one word kind of descriptions of different things that he had to go through so that they shared that language with the medical team so that they could all communicate more effectively together. And she did that through medical play. Other things that can be really helpful, especially for younger kids, but even some of our older kids, you can do different schedules. For older kids or kids that have cognitive capacity to manage it, you can write this more as a list or a plan. For kids that might need to see it more, you can do visual schedules. The examples of ones there, you can actually have your child move the different pieces of like when they've completed this part of the day, you can kind of move it along so it can help them walk through. There's also some social stories you can create that can really help your child, again, walk through their specific medical appointment. You might be able to find some templates online as well to how to do this for your child. We've worked with families to even like take pictures kind of through their medical care with the permission of their medical team, of course, and then put that and personalize it in a book for their child so that they can really see, this is my doctor, this is registration, this is the room where they examine my, do my vitals. This is the room where we're going to do the, the pokes and kind of work through that way. Another strategy that can be really helpful, particularly as a short-term solution, is distraction. I don't know if many of you have seen the Disney movie Up, where the dog on there, sees the squirrel, and every time he sees a squirrel, he's completely distracted and thrown off track. And so one of the things that can help for kids that are getting kind of painful or scary procedures is if they can get distracted, then it can take away some of that fear. Things to kind of keep in mind as you manage that is we want to watch out for overstimulation. I've definitely been with some families where a child's getting upset and then you might have one nurse come in and try something and then a doctor, and then suddenly you've got a room of maybe 6 adults and everyone's talking at once and everyone's trying to like calm the child down. So if you plan more ahead and partner with your child, if you can, you might have the lights low, have only one adult talking and figuring out, okay, what is the distraction technique that will work? The other thing that we want to be careful of is you don't want to use distraction as your only strategy all the time to like distract your child away from some of the hard feelings, because we also don't want to promote avoidance. We want to make sure we give our children the chance to express themselves as well. Another strategy that you can use is really kind of using some mindfulness techniques where you think about in the room. And I think my colleagues spoke about at their hospital, sometimes kids get triggered by like the alcohol smell, for example. So think about like, do you maybe want to have your child chewing gum or smelling a hot chocolate drink, or what can you modify so that it can be a more comforting place? Thinking about for each of the senses, what is your child exposed to and what are you exposed to as a parent? And think about other things you want to modify in the room or on the walk over to the clinic, or, what can you set up that might make it more comforting to yourself and your child? I want to just spend a quick minute here talking about when you might want to reach out for more help. So the guidance that I provide for parents, if your child's emotions or your own emotions are getting in the way of what your child needs to do, either for their treatment or other things, if it's interfering with school, if it's interfering with family life, that's a really good indicator. It's time to get some more support. If you just want more support for your child, go for it. Generally we say, therapy can't hurt as long as you find somebody that understands and is good with kids and has worked with kids. Give it a try. If you want more specific parenting strategies to help with your child's challenges, so sometimes it might be about you want to empower yourself to manage your children. Also, if there's any self-harm, harm to others' thoughts or actions, that's definitely a time to reach out to get more help to make sure everybody is safe. Or if others are concerned. Sometimes as caregivers especially, we're just taking care of everyone else and ignoring ourselves. But thinking about if other people are concerned, listening to them and being like, ooh, maybe I do need some more help, or maybe my child does need some more help. So wrapping up to our conclusions here, medical traumatic stress is very, very common. One of the things that I have heard from parents, once we've provided education and shared they're like, oh, I'm not crazy. Oh, this happens to lots of families. So just to kind of normalize, the journey of neuroblastoma and cancers is really, really challenging. So it's okay to have emotional health reactions. We know that recognizing those signs can be a little bit tricky, but there are things that you can do to help your child, and there's also effective therapies that can help. So ask for help if your child needs it. And there is my contact information. There's also a website called healthcaretoolbox.org on there that I just put up. There's some great resources. There's some handouts for parents, workbooks for kids. All those resources are freely downloadable in case anyone is interested in those as well.